Hi, everyone. Welcome to the Colorado State University Prevention Extension Cast. I'm your host, Nate Riggs, and I'm really happy to be joined here by Dr. Sharon Hoover, an associate professor of psychiatry in the University of Maryland School of Medicine. Sharon is a nationally recognized expert in child adversity and trauma, which is our topic for today. And I just realized not too long ago that we have such an expert that this is one of four of these webinars that Dr. Hoover is participating in today, and the first of two today. So it's great to have, it sounds like we have the right person in the room for us, at least virtually, for our topic today. How are you doing today, Dr. Hoover?
I'm doing great. Thanks so much for having me.
Great, sounds good. Well, before we get started on our topic today, what I'd like to do is I'd like to introduce the Prevention Extension Cast to those of you who are, I'm seeing that somebody might, everybody here, I'm seeing somebody in the chat that can't hear audio. Well, I'll continue. Okay, great. Well, then I will continue. So I'd like to introduce the Prevention Extension Cast, and forgive me while I toggle to my share screen. All right. Here we go. Okay, so the Prevention Extension Cast is brought to you by the CSU Prevention Research Center and the Colorado State University Extension. Grant funding for this comes from the CSU College of Health and Human Sciences, to Dr. Christine Fruhoff, a professor and director of extension in the Department of Human Development and Family Studies, and myself, Nate Riggs, who is a professor of Human Development and Family Studies and the director of the CSU Prevention Research Center. Now, the purpose of this Prevention Extension Cast is to engage communities across Colorado in the dissemination of public health information that's relevant to their daily lives, and to raise awareness of opportunities to participate in research with CSU that is based in true university community partnerships. And this is in line with both the missions of the Prevention Research Center and CSU Extension. So the Prevention Research Center was established to function as a multidisciplinary center committed to partnering with communities to conduct research that can be applied to promoting healthy development across the lifespan in real-world settings. An extension links universities to citizens of each state and is one that disseminates research, information, and expertise in accessible ways, like this cast, and to help citizens use the information to solve problems and improve quality of life. As you can see here, Extension has a presence in almost every county in the state of Colorado, and this provides opportunity to access invaluable local expertise on topics that are important to their communities. So the Prevention Extension Cast leverages this expertise by asking an advisory board of extension professionals who are pictured here, what are the most pressing public health and prevention science related topics in your communities? And then once these topics were identified, our panel here has also generated each of the questions that I'll be asking our guests today on the topic of childhood adversity and trauma, and particularly within the context of COVID-19.
Nate?
So here's the format. I'll be interviewing Dr. Hoover for the next 45 minutes or so. And then after that, we'll have about a 15-minute open Q&A based on the questions generated by you, our audience. So what you can do is you can type questions into the chat bar on the right side of your screen. And then soon after the webcast, what we'll do is we'll send a link to the Prevention Research Center website with the video, as well as some supplementary information, including infographics and things based on our conversation today, and any kind of questions that we're unable to answer due to time constraints. So with that, it is my pleasure to introduce you to Sharon Hoover. Sharon is a licensed clinical psychologist and an associate professor at the University of Maryland School of Medicine. She is in the Division of Child and Adolescent Psychiatry and the co-director of the National Center for School Mental Health. She currently leads national efforts to support states, districts, and schools in the adoption of the National Performance Standards of Comprehensive School Health and Mental Health Systems. Since 2004, she has worked with the National Child Traumatic Stress Network the Treatment Service Adaptation Center for Resiliency, Hope and Wellness in Schools, to train school district and school leaders, educators, and support staff in multi-tiered systems of support for psychological trauma. So we can toggle back and we can get started here.
Nate, could you hear us okay, or can you hear me okay now?
Yep, I can hear you now.
Just so you know, the slides were not advancing as you were speaking. So a few of the participants mentioned that they couldn't see the slides.
Okay. Well, as long as they heard it, I think that's fine. Thank you for letting me know. And we can also, when this is, we can also post the slides on the Prevention Center website as well. But on to the more important piece of the conversation today. We'll just jump right into it. So thank you again, Sharon, for being with us today. And I always like to ask kind of a grounding question off the bat. And so if you would, can you please tell us what adverse childhood experiences are and how they relate to childhood trauma?
Sure. I know the concepts get interchanged sometimes, and it can even be a little bit confusing because sometimes the words are used synonymously, and there is significant overlap, but there are some distinctions. So they're not synonymous necessarily, trauma and ACEs. Traumatic events, we'll start there. Trauma or traumatic events really involve someone experiencing physical or psychological threat. So essentially, they are feeling threatened in an experience, and often simultaneously are feeling helpless or horrified or terrified. Sometimes people categorize trauma into different types, so like acute or singular trauma, or more chronic trauma, something that happens over time to an individual or a community. There's historical or intergenerational trauma, or complex trauma, which really often happens during early childhood and can interfere with attachments and kind of the nurturing or development process. On the other hand, what we're going to spend some time talking about today is the concept of adverse childhood experiences, or ACEs. And this set of experiences are things that happen to young people prior to age 18. And oftentimes people describe them as potentially traumatic. So some of these could be categorized as trauma. It can involve things like experiencing violence or abuse or neglect or witnessing violence in the home. But it can also be experiences that just disrupt the stability or safety or security of a young person as they're growing up. And so it could be living in a household where there's substance misuse, or where the parents might be separated or not available. They may be incarcerated. Family members might be experiencing mental health concerns. And some of the more evolved understandings of ACEs include things also like the adversities of poverty and institutional racism, or other social influencers of health. So that's kind of how we understand adverse childhood experiences, and the slight distinction from how trauma is typically defined. Does that make sense?
Yeah, it does make sense. So can you talk a little bit about, how do adverse child experiences affect us? How do they affect our bodies, our brains, us psychologically?
Mm-hmm. Yeah.
So what is it that happens to us as we experience these?
Yeah. And, the good news is there's actually been a fair amount of research on this, kind of how adversities impact children, both in terms of their brain development and also their psychology or their mental health and well-being, and also how they predict some of the longer term outcomes. In fact, some of the first research around ACEs really was looking at what are the longer term outcomes of adversity in childhood? So how does it impact us when we're adults? But let's start with the biology, the brain. Okay, so if we think about the brain kind of in segments, right? So if you think about the brain having three main areas, the cerebellum, kind of which controls both our voluntary and involuntary movements. The limbic system, which is kind of how we react. Some people call it the emotional center of the brain, okay? And then the cortex, Some people think about that as the outside of the brain or the helmet for the brain, but it's actually inside of our head. And some people call that the thinking part of our brain, okay? So when we experience danger or threat, as with adversity or trauma, the limbic part of our brain, the limbic system, really turns on, okay? And that's an evolutionary response. So it's really actually quite helpful, quite protective. And we know that if we're in a dangerous situation, that part of our brain turns on so that we can fight or flee the situation. You know, we've heard about the fight, flight, or fleeing a situation response. And so one of the things that we know happens when we're in danger and our limbic system turns up is that the thinking part of our brain, okay, the cortex or the prefrontal cortex that's involved in planning and thinking and organizing, that gets turned down because you can only have so many parts of your brain activated at once. So that's really helpful when you're in a dangerous situation. But what we know about young people who've been through adversities is that the limbic system, the emotional center of the brain, is often turned up kind of as a protective mechanism for them in all areas of our lives. And as you can imagine, when a young person is in the school environment, having the emotional center of your brain on alert at all times is really not that helpful in terms of one's ability to access the learning environment, for example, because the part of your brain, your cortex that's involved in thinking and planning and organizing, is turned down. So there's a lot of research that looks at that kind of immediate effect, but we also know that exposure to adversities actually can change the brain architecture for young people. So the more adversity or trauma they're exposed to, the actual pathways change in the brain, the size of these systems actually changes. So your hippocampus, where memory happens, becomes smaller, your amygdala, the emotional center, becomes bigger. So there's a lot of ways that adversity actually impacts young people. We also know psychologically that for our young people, adversities can impact their sense of safety, their sense of security and stability, which can interfere with their ability to attach to their caregivers, to their peers, to feel connectedness in school. And then there's some really good research looking at kind of the longer term outcomes, right? So we know, for example, that people who've been exposed to 6 or more ACEs are likely to, or on average, likely to die about 20 years younger than their counterparts who've had no adverse child experiences. And people with more ACEs are likely to go on to develop more negative health outcomes. So there's a lot of potentially negative long-term outcomes. But it's not deterministic in the sense that these things can't be reshaped. So hopefully we'll get to speak to kind of some of the ways that we can prevent or protect against adversity.
Great. Yeah, that actually is a great lead into my next question for you, is that, my understanding is that adversity is relatively common in childhood, but that not all youth respond to adverse child experiences in the same way. And so what might be some of the protective factors that can contribute to childhood resilience in the face of adversity?
Mm-hmm. So yes, you're right, first of all, that adversity is common, right? So some of the first folks who studied ACEs were Kaiser Permanente, and the statistic that's often quoted is that about 2/3 of adults will have experienced at least one ACE or adverse childhood experience, and about 1 in 5 adults will have experienced 3 or more. And then the Centers for Disease Control have also, subsequent to Kaiser, done a lot of research, and they found similar numbers. So most people have experienced adversity in childhood, but the more adversities are more predictive of kind of more negative outcomes. That being said, we know that it is not deterministic in the sense that if you've experienced these 2 adversities, everyone's going to land in the same place. So one young person who's experienced a traumatic event may go on to develop post-traumatic stress disorder and have a number of negative outcomes, but another young person who's experienced the same traumatic event may go on to have very little disruption in functioning. And so there's been some really great science looking at, well, why is that? So there's been some science looking at kind of the risk factors, that when a young person has multiple risk factors, they may be more inclined to go on to experience negative outcomes. But there's also kind of this science of resilience, or science of thriving, some people call it, that look at some of the protective factors. And so some of the ones that stand out, there's been a lot of science on positive parenting practices. And that doesn't just encompass the biological parent or adoptive parent. It's really looking at what are the caregiving practices of the adults in children's lives. And when we see things like catching children being good, or active playing and reading with children by the adults in their lives, that's really protective. We know when there's societal norms about positive parenting, that's really protective. There's been some great research looking at when they have a feeling of connectedness, when they're involved in more activities in school, when they feel supported by their peers, it can actually completely shift how they respond to adversities. I'll go ahead and put a couple of resources into the chat box looking at ACEs and trauma, but also wanted to share one of my favorite resources that looks at this idea of kind of resilience and positive or protective factors. There was a report that came out called Balancing ACEs with Hope, and HOPE stands for Health Outcomes of Positive Experiences. So there was this whole kind of study really looking at, well, what about the positive experiences? What are the health outcomes for young people? There's a lot looking at what happens if you have ACEs, but what about positive experiences? And so they looked at things like nurturing and positive relationships, safe, stable environments to play in, social emotional competencies. So there's a number of protective factors that can actually really change the trajectories of young people exposed to adversity. So I've gone ahead and put that into the chat box, and I'll throw another one in there called Parenting Matters, which just looks at some of the parenting practices that I mentioned.
Wonderful. Great. Thank you for those.
Sure.
So this also kind of leads into the idea that there's some malleability in young people's response to adversity. So what are some of the things that, or some of the ways that youth serving professionals, including our extension professionals in the audience, can do to support childhood resilience when youth are exposed to several adverse experiences?
Right. So there's a lot that the adults in young people's lives can do, and it's probably no surprise to the participants today that adults having a positive, supportive adult is one of the most predictive factors of successful outcomes, even in the context of adversity. So the more positive, nurturing, protective adults that a young person can identify in their life, the less likely they are to go on to develop some of the negative outcomes. And then there are certain practices that, whether you're a parent or a youth serving professional, you want to keep in mind. Some of those align with the principles of trauma-informed approaches to care, or to parenting, or to systems. So we think about, for example, how do you promote safety, right? So we know as a parent or as a youth serving professional, there's a lot you can do to make a child feel that they're both emotionally and physically safe. That can be in the environment, but also just in your daily interactions with a young person, fostering trust with that person. Fostering trust and transparency is part of kind of a trauma-informed approach. Communicating clear, consistent, predictable routines and rules is really important as a parent or youth serving professional. Another thing we can do is foster support with peers, given especially as young people enter adolescence, we know that peer support is absolutely critical. There's a concept also of kind of shared decision making with young people, and it turns out that when we offer opportunities for shared decision making with young people, especially adolescents, they're much more likely to feel a sense of support from the adults that they're working with, and so that can be useful. Even just letting young people know that their feelings are valid, even if they may seem irrational to us as adults, letting them know that it's valid to have those feelings. And then there's a lot of things we can do programmatically also. I'll go ahead and share another resource in the context of ACEs that actually speaks to some of the programmatic things that we can do And that's things like strengthening economic supports to families, making sure they have really positive early child experiences that can include, high quality childcare, home visiting to young families, teaching skills like social emotional competencies, and that can happen in the classroom. There's a lot of emphasis on social emotional learning skills, but that can happen in lots of kind of young child serving systems. So a lot of programmatic things that we can do as well.
Great, thank you. So as many of you probably, you're all aware that this discussion is really relevant to the current COVID-19 pandemic. Sharon, what are your thoughts on it? Would you consider the COVID-19 pandemic an adverse childhood experience, or is it something that can trigger psychological and physiological responses that have roots in childhood trauma, or could it even be both?
So it's a good question. And, I think whether the pandemic is viewed as an adverse child experience is in some ways largely dependent on the circumstance of the child or family. I think it's arguable that this is an adverse experience for the nation and internationally, really for everyone, because of the great economic and health toll it's taking. So we know there'll be both immediate and long-term consequences, but the degree to which it would be kind of defined or considered an adverse child experience that will directly impact the functioning of a young person, again, I think varies tremendously by one circumstance. So for some families, right, they're going to experience immediate health and or economic burden. And in some communities, right, so we know that there are some communities that are being harder hit, especially communities of color, lower resource communities. They're being harder hit by COVID than other communities. So those children and families are likely to experience more what would be akin to an adverse childhood experience that might be predictive of negative outcomes. For some where COVID exposure is lower, or perhaps there's more resourced communities, the impact may be less. And then kind of the second part of your question, I think you mentioned kind of, could this kind of compound with or trigger prior trauma or adversity experiences? And the answer is yes. There's actually, really good literature that when we've been exposed to trauma, and especially if we've gone on to experience post-traumatic stress, the layering of traumas is likely to have a worsening. You have kind of a more poor trajectory or path than if you had not had that prior traumatic stress. And we've seen that in communities like post-hurricanes Katrina and Rita, for example. When young people had a history of post-traumatic stress, they did worse off than those who didn't have that type of post-trauma experience.
All right, thanks. So you had talked a little bit about how youth-serving professionals and parents can help children deal with stress. What are some ways that they can help their young people deal with stress specific to COVID-19?
Yeah.
And are there ways that parents can even maybe frame this as an opportunity for growth?
Yeah. So I just placed a few more resources in the chat box to address this idea of kind of, parents and caregivers responding to the pandemic. And I know in some ways we're all being bombarded with resources. And so we've tried to pull just a few that I found really helpful. I'm a parent of 3 teens myself. And so, we're trying to navigate the distance learning with also making sure that we're attuned to any stress or anxieties or fears that they may be experiencing. And so there are certain things that we can do to just assure that our kids are doing okay. One of my favorite resources on the topic came out of a group called Child Trends, and they talked about ensuring that parents need to ensure that you're doing the 3 R's, and not the 3 R's that we're used to, but rather reassurance, routines, and regulation. And so the idea is that, first of all, kind of our number one job as parents is to ensure that your kids are feeling safe and loved, and that, they recognize that there are adults in their environment that are caring for them, respond to their questions. Routines, as much as possible, try to have some structure or routine. And I'll say with all of this that we need to also give ourselves grace. It looks like one of the links is not working, and so I'm happy to revisit that as we go on later, because that's actually a great resource. I just noticed a couple people chatting, so I'll share that. It's some scripts and strategies for parents and educators to use. And then the third R is this idea of regulation. So we've already talked about kind of what happens to us physiologically when stress happens. And if young people are feeling stress amidst what's happening, whether it's because they have immediate health or economic concerns, or they miss their friends, or they're missing out on activities from school, they may be more dysregulated than usual. And so you can help them with those reactions by validating. So I know this might feel scary or overwhelming. So that's just the validating part, but also then giving them some tools. And it may be as simple as teaching them some relaxation. Someone asked me to repeat the 3 R's, no problem. Reassurance, routines, and regulation. And I think one of the resources that I shared by Child Trends has a bit more of a description of those. And then some other things that caregivers can do is to try to keep children busy, to try to keep them active and distracted. So while we're on the one hand wanting to validate and reassure and allow them to feel whatever they may be feeling, whether it's worry or anxiety, it's also important that we help them kind of develop the capacity to cope. Now, I know it's easy for me to say, go ahead and keep kids busy and keep a routine. But I know that that's not always easy to do, especially when either you're suffering from health or economic concerns, and or you're trying to navigate your own work while supporting distance learning. So it's important that you also set realistic expectations for yourself and others. And kind of the last point that I would make here is, we know that there is great concern about the potential for increased child abuse and child neglect during this time, and family violence in general. And that's in part just because we know, historical data shows that when economic and health burden goes up, so do those factors. So it's really important as caring adults in the community that we try to kind of offer resources to families who might be most vulnerable. And also as parents, just to take a break. We hear parents say, I'm the worst parent, I'm putting my kid in front of a screen just because, for hours because I can't navigate all of this. Give yourself grace. It's, whatever we need to do to get through this time and recognize that it's temporary. So I see another concern that the Google Doc is incomplete, right? So I'll find the full link to that and share it.
Great. Thanks. So that's another great lead into my next question that I have for you is that, this event isn't only causing stress for young people, it's also causing stress for parents and adults. And so what are some specific coping skills do you think the parents can practice for their own health during this time?
Mm-hmm. So, I think it's a tough question only in the sense that my answer is, in this area of practicing self-care. And I think that can feel in some ways insufficient to us as parents. How do you expect me to practice self-care when I'm, trying to navigate all of this, and stop telling me just to take better care of myself. I can only do so much. So I think I want to preface it with that comment, because I think there is truth to it, that we can only be told so much about just practicing self-care. That being said, there are some self-care strategies that we think are really important during this time, and you can think about it in some different dimensions. So physical self-care, to the extent possible, trying to maintain kind of healthy eating habits and sleep habits, limiting the use of alcohol or other substances, trying to get adequate sleep. I've heard from a number of people, oh, my sleep schedule has gone totally haywire. We encourage people, especially if they're starting to feel depressed or anxious or more worried, to try to get back on a sleep schedule that's more routine or regular, and their kids to do the same. Limit the use of devices, including media and social media. Emotional self-care, kind of know your limitations. we know that many of us as helpers take on traumatic stress of the people that we're helping. And so we need to make sure that we're creating some boundaries around our work and professional life. I've heard from many people the term Groundhog Day during this time, that, the days are feeling repetitive, and, they're feeling that they kind of run together. How many times have we looked up and said, what day is it? Is it the weekend? Is it Tuesday? And so that really takes a burden on our own, well-being. And so trying to create some of those structures and boundaries between work and home are really important. Social care and connection, really important, but challenging during distancing. One of my trainees recently said, I'm just trying to schedule in the contact with families, with her family rather, in the evenings, because she was letting work kind of bleed into the evenings. And so those kinds of social connections are really important to keep as well. And I see a question pop up, some recommended coping strategies for parents. So some of the ones I just mentioned in terms of physical self-care, psychological self-care, social support. We've also heard from parents, how do I just take time to myself? And, some concerns about screen time. They've heard that screen time is bad for kids. I think you want to exercise appropriate controls as possible in terms of the media exposure for your children, but also recognize that some of the data that's out there on screen time is kind of the long-term chronic exposure, especially to negative media content. So it's not about kind of a 2-month period where everyone's just trying to do the best they can. So if you need to increase screen time so that you can take a break at times, that may be a helpful solution.
Great, thank you. And so we all interact as a dynamic system within a family in the ways that some of us handle and cope with stress might affect how others react to stressful situations. And I'm wondering what your thoughts are on, how it might be that how parents respond and cope with stress, and can that affect how their young ones respond to stressful situations?
That's a good question. The answer is absolutely yes. And there's really good data to show that the way that parents cope with stress and stressful events directly impacts how children cope. And we can think of, really 2 main reasons for this. First is the idea that parents model coping for their children, right? So if they model resilience and healthy expression of feelings, including fear or worried, coupled with kind of healthy coping skills, whether it be distraction or humor or seeking social support, their children will follow. Not necessarily, to the T, but they will recognize that, okay, there's some kind of healthy ways of coping with this stressful situation. And then the second reason we know that children's functioning or coping is impacted by parents is because when parents are overwhelmed or unable to cope with the pandemic right now and the negative outcomes of the pandemic, they are less emotionally and physically available for their children. And so we know, for example, there's a long literature on if parents are suffering depression or severe anxiety, their children are likely to suffer as well, in part just because of the emotional unavailability of the parent. So it's absolutely, the old cliche of putting your oxygen mask on first is really apropos right now. It's important that parents and other youth-serving adults take care of themselves in order to adequately care for young people.
Great. Okay, thank you. I also want to just remind folks who are here with us today, if you have any questions that pop up for Dr. Hoover, and you'd like to ask them, feel free to ask them in the chat bar to your right. Coming up on the last couple of questions that we have prepared for her today. So please feel free to ask any more questions that might be popping up for you. So eventually, this pandemic is going to end. But we can always be thinking forward about how we can help children transition back into society and cope with how regular life may change after the COVID pandemic is over. What are your recommendations or thoughts about that?
Yeah, so a quote that's come up in a fair number of discussions I've had is the one from Einstein about in the middle of difficulty lies opportunity, and so people are trying to think. I've heard conversation about what are the silver linings, what are the potential positive outcomes. So that's absolutely part of the discussion that can be useful for young people right now. And it's not to take away from the realities of the hardships that are associated with the pandemic, but really to help also recognize what are some of the learnings that can happen, what are some of the opportunities. And so first and foremost, I would say ask your young people. I mean, we've had a number of conversations with young people about how do you think life will be different? What are some of the learnings that people will have? How do you think, at the dinner table even, it can be, how do you think people will greet each other in the future? As simple as, will people continue to shake hands? What might that look like? So get your young people's input on how they envision the future might be different, ways that, it might actually do better for the world. And it can be things like, how do you think people will use technology different? I mean, I know certainly in the education and health sectors, people are talking about the potential advantage of this abrupt shift to telehealth and distance learning. While it has been incredibly stressful and difficult on those systems, there is also the potential to transform the way we do healthcare and education, and the loosening of some of the reimbursement for healthcare via tele, for example, really could transform our ability to serve more rural and low-resourced communities. So there's some real silver linings there. We also, have heard within the environment sector the idea of, and this is a great discussion with kids, how do you think everyone stopping commuting or staying at home has impacted the environment, and what are the lessons learned there? Should we be moving to telecommuting in some ways more than we were before? So I think, it's important that we have those conversations, remind our young people about the, kind of how we can learn from adversity, and talk with them about that concept of resilience as well.
Great, sounds good. Okay, so that pretty much is it for the prepared questions that I had for you that were generated by our extension professionals. I've seen a couple of them pop up in the chat bar recently. So I guess the first one that I see is from, let's see, Chelsea. She's asking, do you have any suggestions about community care as a supplement to self-care during this time?
It's a really good question. And again, I think it speaks to the idea that we can only do so much in the form of self-care, and that it's really important that we rely on our community partners. So it depends on, kind of what care we're looking for, right? So I'm in the mental health sector, and I know in discussions with our community mental health systems across the nation, a lot of them have actually seen a downtick in the use of their services, whether it's employee assistance programs that a lot of adults have access to through their employer, or just community mental health outpatient centers, for example. And so a lot of our community partners are saying, we're here, but folks aren't sure kind of how to access them. And so I would say, some communities have really mobilized to get the word out about, here's our community mental health systems that are available. Here's our other community child or family serving systems that are available. So to the extent possible, to get the word out in communities about how families can access these partners, many of whom, it took a little while, but many of whom have shifted to remote support, so there may have been a 2 to 4 week gap in getting systems up and running, but there's a lot of community providers now who are trying to offer their supports via tele. And our school system, of course, would be another community support as far as how to, better equip families and young people with coping strategies during this time. We know schools have, again, had a very quick learning curve and a lot of considerations around equity to try to get distance learning out, but they're also really trying to attend to the social emotional needs of families. And so a lot of school counselors and support systems are offering office hours now for students and families that they can call in to get support around any stressors or anxiety. So it's a great question, Chelsea, and I know there's a lot of community partners that are really eager to support families during this time.
Super. All right. So Tiffany asks, can we get all these resources in one document?
Yeah.
And she can't keep up writing them down. So these are great resources from that Sharon, Dr. Hoover has provided. Sharon, you might have some ideas for this. I know that what we can, as a prevention center, can work with Sharon on getting those all in one document, all those links into one document, and then putting them on the Prevention Research Center website. And we'll be sending an email out to everybody who registered for this webcast, and we'll send you that link so that you can access them.
And I would say that probably 90% of the resources that I'm sharing or more are on our school mental health website. So it's schoolmentalhealth.org. So that's easier probably than writing down the thousands of resources here. So schoolmentalhealth.org, in the top right, we have a COVID-19 resource page, and we've broken it out into kind of supports for students and families, educators, mental health providers, and so forth. But yes, I'm more than happy to share just those that I shared today as well, of course.
Great. Thanks, Tiffany, for that question. Aaron asked, do you have thoughts about how early childhood educators can support children during this time, remotely and then back at school?
Yes, I know our early childhood partners in our division have been actively, working with our early child educators to help them, because they are tasked now in some ways with trying to reach out to families, trying to connect with them, trying to help even coach families and some of the social emotional well-being supports that they offer daily to children. I'm happy in the resource document to share some of the early childhood resources, but some basic strategies include daily check-ins. We've seen a lot of our K through 12, but also our early childhood providers doing a daily check-in where they may just send a link via text or via an email to families, where the families can answer. I've seen 3 to 6 questions, things like rate how you're doing today, describe why you're feeling this way, if you need someone to reach out to you, who might it be? So in the K through 12 setting, it might say, the principal, the school counselor, the math teacher, and so forth. And that way there's kind of an immediate daily check-in with families. It won't necessarily work for all the families that we're trying to reach, but a lot of our early childhood providers and our K-12 providers or educators are saying that daily check-in has worked. A lot of our social emotional learning programs are offering their resources free online now. So I know a few that are on our schoolmentalhealth.org website. They offer both early childhood social emotional skills that are now being really kind of translated for families to adopt. So PATHS is just one of them that I can think of. Positive Alternative Thinking Strategies is the acronym, but they are offering all of their resources right now at no cost, and so families are able to go in and access some of them.
All right, thank you. Julia asks, how is child defined for ACEs? Is it 0 through 18?
Actually, anyone under 18. So essentially, yes, that's how it's historically been defined.
All right. Great. This next question is, I think, a really great question. It seems like ACEs perhaps overlooks the impact of systematic racism. And we're seeing that the effects of systematic racism and subsequent poverty are creating large disparities for communities of color. The Colorado Department of Public Health and Environment data has shown that Black and Brown communities are carrying a heavier portion of COVID cases. I'm curious if you have considered these disparities when talking about ACEs and subsequent strategies.
It's a really important question. And so going back to kind of how ACEs was originally defined and studied, I wholeheartedly agree that systematic racism, poverty, inequities, and some of the social factors of health and education really weren't well considered when ACEs was first defined and studied. As I mentioned earlier, the thinking and kind of study of ACEs has evolved since then. One of our colleagues in Philadelphia, Dr. Roy Wade, has done a fair amount of work looking at systematic racism and how we can conceptualize it as part of ACEs, that, you know, racism is an adverse childhood experience. Living in poverty, having food insecurity, housing insecurity are adverse childhood experiences that weren't on that initial checklist. So the initial checklist of ACEs really was just a list of 10 adversities, and the initial intent was looking at, if someone's experienced these, you know, what are their adult health outcomes? But it at the time it was developed, it wasn't intended to be a comprehensive look at adversity and its impact on children. And again, since then, it really has been looked at. And we know, as you're alluding to, May, that in the context of COVID, our inequities in our communities have just been amplified. I know, you know, working in Baltimore City and also in Prince George's County, Maryland, they're two of our hardest hit communities in Maryland with COVID. And our young people and families of color are disproportionately impacted, not only because of the higher rates of exposure right now, but also the lack of access to healthcare and education. And so it's absolutely essential that we talk about these as part of ACEs and as part of how we think about, you know, kind of navigating supports and protective systems. So one of the links I mentioned kind of was the CDC link to what are some of the programmatic strategies to take to buffer against the impact of ACEs. And part of that gets into kind of how do you address some of these structural inequities for young people and families. So thank you for bringing that up. And one other thing, you know, there's been a movement to kind of do these ACEs checklists or ACEs assessments in pediatric settings or schools, and so I just want to mention that some people are still using screeners that first of all, I don't know that movement is entirely warranted without kind of some of the supports in place to do that type of screening. But beyond that, some of the systems that are doing ACEs screening are not considering those equity factors that are, you know, very important for young people's developing right now. So we want to keep that in mind as we're thinking about how we assess and understand ACEs. So thanks to May for that really important question.
All right. Heidi asked, do you have any advice or thoughts around ACEs and how they impact gifted, twice exceptional, and special needs students and their parents during this time?
Yeah, really great question, Heidi. And admittedly, I have not read a lot on the intersection of ACEs with gifted or twice exceptional or special needs students. You know, we know that adversity, you know, when there are multiple adversities, certainly it can compound the potential for negative outcomes. I'm not sure how that kind of intersects when you've got unique needs, whether it be giftedness, twice exceptionality, or other special needs. One of our colleagues, Shannon Soldo, down in Florida, has done a tremendous amount of work looking at students with these unique considerations. And I'm happy to reach out to her and better understand kind of her study of the intersection of this with ACEs. But I'm not too sure in terms of kind of what the literature says right now about the overlay of ACEs with these populations. Now, in terms of kind of just my off the cuff thinking, as opposed to delving into what the literature says, you know, I know that for families who have students with special needs, whether it be giftedness or special learning needs or, you know, differences in learning abilities, there's kind of a, you know, we know among some of those families, there's both a unique resilience that they may have had to adopt based on their need to navigate multiple systems. And so in some ways, you could imagine that those young people and families may be better equipped to deal with adversities that may come, but they also, as we talked about, kind of the layering of adversity or trauma, when you have multiple challenges that you're contending with, it could also present a greater overall challenge or potential for negative outcomes. So it's probably highly variable in these communities as to how ACEs overlays, but a really important question and research question as well.
Great, thank you. Looks like Rachel would like to put together a resource list for the summer. It looks like she's from Fort Collins. And she'd like to collaborate with some folks on that. And I would like to say that the Prevention Center would be more than happy to do that. If you'd like to email us at prevention@colostate.edu, please, you can do that and we can get that started. And when you do that, feel free to, or if you do that, feel free to include any of the other important partners that you'd like to collaborate with in that process. And maybe we can even convince Dr. Hoover to help us out with that.
Yeah. And our school mental health COVID site is evolving really daily, and we're leveraging a lot of the really great work of some of our partners with respect to the school resources. Since this question came from a local school system, we've relied heavily, for example, on our partners at the National Association of School Psychologists, who've been putting out tremendous resources for school mental health professionals and educators and families. So we're happy to help collaborate. And one of the things we're trying hard to do is to not recreate the wheel and recreate, because so many people are creating really helpful resources right now.
Great. Okay, thank you. So we have one, how do we support parents in low-income communities if they do not want help? For example, supporting parents of minority cultures who have their own traditional parenting styles, or better yet, how do we make this information accessible to them to understand the implications COVID-19 can have on their children and the parents themselves?
Yeah. So Graciela, it's a really important question. And one of the conversations I've had with a number of our national partners is that the well-intentioned, professionals and professional communities and organizations have very quickly put out lots of resources. And I think, very shortly after that spike in resource development, there has been a stepping back to say, have we really listened to the communities to hear what the needs are? And so I've been in that conversation, for example, with a number of our newcomer and refugee and immigrant communities to better understand kind of what the resources are. There was a spike in resource development and then a bit of a spike in multi-language resources, so kind of the translation of those resources. But I think where hopefully many are, and this hopefully speaks to your question a bit, is how can we better hear from the communities about what it is that they want? So it's not just a matter, of course, of us better pushing the developed resources out to communities. Maybe it's that we're not attuning to the actual needs that or ways of support that are established within a community. So we know, for example, that kind of supporting families in returning to or embracing their own culture, their own cultural routines and rituals can be absolutely healing for communities. We've done a fair amount of work with our Native American, Alaska Native populations, and we talk with them a lot about culture as intervention. And so I just want to kind of say that, as a general response, part of it is that we may just need to better hear from our communities, whether it's a minority community, community of color, a low resource community, about what it is that we need before investing all of our efforts in just getting our resources out. And also identifying the key opinion leaders within those communities. Are there faith leaders? Are there parent leaders who can best speak to the needs of the communities? And it may be holding town halls and community forums to understand the needs better.
Thank you. let's see here. I guess we're getting down to it. And I want to thank Dr. Hoover again for such a great conversation today. And I just wanted to ask a final question is that, what's any other final thoughts or advice that you might have for youth service providers or parents as we continue to deal with the COVID-19 pandemic? Any parting thoughts?
Yeah, I mean, we've spoken a bit about this already, but, I think it's really important for us all to remember that there is a temporary nature of what's happening. That doesn't mean that it won't have permanent impacts, but helping us kind of keep in mind that this too shall pass in its own way, in its own time. And in the midst of adversity and challenge, that we also want to embrace for ourselves, but also support our children and families that we're supporting, embrace optimism and hope, and really keep in mind the remarkable ability of the human spirit to thrive and flourish in the face of adversity. But that simultaneously we have to look out for our most vulnerable populations, and that includes our children and families that are hardest hit right now. And so make sure that, aligned with the last question that was asked, make sure that we are being intentional about listening to those communities that are marginalized, about what their needs are, and not just their needs, but what they can offer as far as their own healing and healing from others. And also, I think, rethinking how we engage during this moment in time, how we engage with children and with families. Can we support them in, fostering those family connections? So while we're reasonably worried about child abuse and neglect, how can we help families to kind of reshape the time that they have together, to reshape some of the rituals and activities that can foster growth during this time together? And just be supporting, the educators and the parents who are doing their best. And I, throughout all of these conversations have talked about giving ourselves grace and giving each other grace, in the sense that we just need to recognize that this is a stressful time. It can be draining and tiring, and you need to find time for personal space. So be kind to yourself and to others.
Great, thank you. And I imagine that our conversation today has drawn a lot of interest, and so I guess I lied to you. That wasn't my last question for you. My last question for you is, if someone wanted to connect with you, how could they do so? Do you have social media links or anything like that they can connect with for more and continued information?
Yeah, so I put my personal email address in there. That's easy to reach me at. There's also a Twitter handle. So some folks are tweeters. There's my Twitter handle. And then the other place to reach us is at schoolmentalhealth.org. So I'm sticking that website in there. And you can always, send an email to our general website at the National Center for School Mental Health, or to my personal email address there. And I know I promised to share the Google link, the full link. So I'm going to see if I can quickly do that as I know have some closing remarks to make. I want to try to make sure I can get that out there to folks.
Sure thing.
But also you can find it on the School Mental Health website.
Great. One final question is there a way for others who didn't register for today, but I think could benefit to watch later? Yes, we will be posting this entire webcast on the Prevention Research Center website. And so what we'll do is for everybody who registered, we'll send you out that link, and then feel free to forward it to anybody who you think could benefit from this conversation. So great, thank you. So thanks everybody for joining us today. We had an incredible turnout for this conversation. And if you ever in the future would like to partner with the Prevention Research Center on this type of work or any other type of health promotion, behavioral health prevention work, feel free to drop us a line at prevention at CS Colorado. Sorry, let me get the right one. It's prevention at colostate.edu. And again, just one last time, we'd like to thank you, Dr. Hoover, for taking your time out of your day today and sharing this really, really important work.
Thank you so much. It was a lot of fun. Thanks for all the great questions, everybody.
All right. Take care, everyone.
Take care.